sometimes you see a woman trying to conceive for just 2 months and they are concerned that I'm not able to give birth. So medically, what is infertility?
If I look at the WHO definition of infertility, it will be when a couple are having regular intercourse. And by regular intercourse, I mean at least 3 times per week. And I'm going to qualify, and not Friday, Saturday, Sunday. That'll be 3.
Yeah.
Spaced out.
Okay.
But for infertility, we use 1 year for those people who may be having a problem. Waiting 2 years before we start investigating would be too long. So we normally just give that cutoff period 1 year.
Is there anything like early detection also? Because I know medically early detection equals to better treatment.
Your fertility is limited. I know people would argue, oh, I can freeze my eggs and all of those things.
Yeah.
But I really like to ask people that
when you talk about age 35, does it mean that it's about getting your first baby before 35 or all the babies before the age of 35?
Okay.
Welcome to the Purity Afya Show, the only place where you will get much content, much information on women's health, some of your questions on women's health, gynecological topics to mental health answered by experts within their own field. My name is Purity Afya Show, and today we are uncovering the silent causes of female infertility with Dr. Maureen Owiti and some of the things that women should know early enough. Thank you so much, Doc, for being here. I don't know whether we should be defining infertility. We should, because sometimes you see a woman trying to conceive for just 2 months and they are concerned that I'm not able to give birth. So medically, what is infertility?
Okay, I think there's some clients, they come and see me and just say, I heard daktari amenoki sana or something. Yeah. I laugh because you find somebody comes, they have just said 2 months, 3 months, and they're like, I'm not getting a baby. Then I'll start laughing. I'm like, when did you get married or when did you start trying to look for a baby? She says 2 months ago. I'm like, hey, my sister, just go, come back next year. Same time, same place, talk, I'll hear your story. Yeah. Anyway, so infertility, broadly classified, we say, if I look at the WHO definition of infertility, it will be when a couple are having regular intercourse. And by regular intercourse, I mean at least 3 times per week. And I'm going to qualify, and not Friday, Saturday, Sunday. That'll be 3. Yeah. Spaced out.
Okay.
During the week. Okay. At least 3 times, in a woman who has regular cycles, okay, and they're not using any form of contraception. And, you know, people find, I find it very strange that people don't find condoms as a form of contraception. I just find like condoms are a form of contraception. Withdrawal, okay, would be a form of contraception. So not using, counting your days to avoid the days, your fertile days, would also be a form of contraception. So not using any form of method to stop pregnancy. And in a young couple, okay, who are very healthy, this can take even up to 2 years. But for infertility purposes, we keep the definition as to 1 year, so that if a couple, because you can have normal couples, it's actually absolutely nothing wrong with them. And within 2 years, they will actually be pregnant. But for infertility, we use 1 year for those people who may be having a problem. Waiting 2 years before we start investigating would be too long. So we normally just give that cutoff period 1 year. And this is in a couple whereby the female partner is less than 35 years. Okay? So it's telling us that for women, age has a very impact on their fertility. So we know for women up to the age of 35, they are at peak fertility, but after the age of 35, their fertility is going to dip and it's going south. So we really...
So is it exactly after 35 or there's plus minus there?
Obviously, in a normal population, there'll be the plus minus. Okay. We have people 28 and they're already in they already have a premature ovarian failure, cannot conceive. And you have your Sarah's, your 𝗂𝗶𝗸𝗲, still giving birth at 60, 70 years. But your 𝗂𝗶𝗸𝗲, we know there was divine intervention. Where there's divine intervention,
anything is possible.
Anything can happen.
Yeah.
So, but in nature, it's very rare to be having children past the age of, say, 55. But you'll still find 50 or 56 now. When I mean, you're like, wow. I think a very stressful situation, if you ask me. For women above 35, because they don't have time, it'll be the same. So regular intercourse, regular cycles, no contraception, but their cutoff will now go to 6 months. We give them 6 months because it's too long to tell a woman who's above 35 to wait for a year to find out that she's going to conceive or not. Okay? Now, what would be causes of infertility? So remember, and I prefer the word subfertility, but the topic is normally infertility, it's a couple. Okay? So we know 50% of causes will be because of the male and 50% of causes will be because of the woman. But if I'm to lump it up in terms of broadly, directly to the man, it's about 30% is attributed. Directly to the woman, 30, and combined another 30. So plus minus, you get your 100.
So, Doc, even before we get now to the what could be the problem if you're not conceiving after 1 year or 6 months, if you're over 35 years. So how do you diagnose this problem? I have come, we've tried for 1 year, as a couple, we are newly married, you've told us to wait for 1 year. After 1 year, nothing is happening. So now, how do you diagnose? What is the next step now?
Okay. So, now, definitely the first thing is we're going to take a very thorough history. Even that person who I'm telling 1 year, we have taken history to rule out, have they had any abdominal or pelvic surgeries? Do they have any red flags, like do they have diabetes or any hormonal problem that could be leading? So from your history first, you first establish if there's anything that warrants an immediate check at this time. If they pass, we send them away. Now, if they're back, okay, we now look for the obvious thing. Easiest, simplest test to start with will always be checking also the male partner. A male partner simply needs a semen test, and we call it semen analysis, and it will give you a lot of information. Sperm test, whether or not it has issues, you also have to investigate the woman. So it's understanding that, remember I've said you can have a combined, whereby both the male partner and the female partner have a problem. So the fact that you find a problem with one person does not mean the other person does not have a problem. And the fact that we have a problem with one person does not rule out a problem with the other partner. So we still have to investigate the other partner. Women, God made us very complicated. So men, just forgive us. Even our physiology is complicated. I've said for the man, we're only doing one test, a sperm count. For the woman, we'll start. First things first, we have to know, is her reproductive tract having any problem? So is it blocked or not blocked? Is there a block anywhere? So we do a horrible test. It's either what is called a hysterosalpingogram or what we call a sonohysterogram, whereby you use the ultrasound. So you put in dye and you're able to see the dye moving through the reproductive tract. You can see that the uterus is fine, the tubes are fine, and this dye is actually getting into the pelvis. And that's the first thing, to ensure that the tract does not have any, has not have any blockage.
Yeah.
Tubal blockage is very common, especially in this part of the world, because we have very high incidences of infection, like pelvic infections, that could lead to blockage. And then there's, I wouldn't say new kid on the block, but I think for a lot of people, again, the interplay of endometriosis, which would also cause damage to the pelvis and lead to potential tubal or even blockages around the ovary, the ovary itself.
Yeah.
Again, we've said, how's the menstrual history? So you find definitely, if somebody tells you she has irregular cycles, you're not going to tell them wait for 1 year. That's somebody you're going to investigate immediately.
Right.
Do they have any hormonal issue? But it's understanding somebody could have a hormonal problem and still have regular cycles.
Yeah.
So that would be your next battery of tests.
Yeah.
And then you look for simple things. I know fibroids don't necessarily cause infertility, but if you have, say, fibroids inside the cavity of the uterus, it can act like a coil. So you do, again, your ultrasound just to see anatomically, is the uterus normal? Is there anything in that uterus that could lead to infertility or even miscarriage? Those will be your basic tests.
Yeah.
And it's based on the results of your basic tests that you'll decide whether I need to go further, do other tests.
Yeah.
So, for example, you don't find any sperm in the semen. You would want to do other tests to try to qualify what's causing this.
Yeah.
And exactly what type of lack of sperm is this? Is it because of a blockage, or is it a problem because they're not producing? They're not producing the sperm. So that's what you do. So once you've identified what you feel the cause is it hormone? Is it hormones? And is it the tubes? Is it a sperm issue? Then you address. You address the cause, and that way you're able to help the women conceive.
And there are these conditions that you've mentioned, fibroids and all that, and I know they're accompanied by signs like heavy period. So just like any other problems in women, for infertility, are you able to tell, are there earlier signs that if, for example, you have 1, 2, 3, and 4 and you're trying to conceive, then it's important for us to check and not wait for 1 year?
Okay, I think the easiest people would be people who have irregular cycles. Yeah, those I think would be very straightforward.
And what do you mean by irregular?
So, like PCOS patients, the people who have periods once in 3 months, that's definitely not normal.
Okay.
How often are they ovulating? You find many of the cycles, they're not ovulating. They could ovulate occasionally. So it's not to say that you have PCOS, you cannot have a child 100%. But it means you're not ovulating as frequently as you should to enable a pregnancy. Okay, so let's talk about treatment options. You found the female has the problem. Are there options, or it's quote unquote a death sentence? Okay.
And is there anything also to do with, is there anything like early detection also? Because I know medically early detection equals to better treatment.
Okay.
Yeah.
So again, I don't know how I would counsel women, because what has happened with modern life is even those women who would want to get married and have families are tending to put that off to a later time. They want to go to school, want to get a good job, want to move up the corporate ladder before they have their children. And
have a good life for your children before they come. Yeah.
So some of those things whereby we need to have that conversation with women, that all those things, school, even at 70, if your faculties are still correct, okay, you want to become a professor of this or go into a new profession altogether. You can
go back to first year anytime.
You can start at any time. And especially with the advent of online, you don't even have to go to school physically to get a degree. It's something you can get at any point in your life. But your fertility is limited. I know people will argue, oh, I can freeze my eggs and all of those things.
Yeah.
But I really like to ask people that, okay, I'm somebody who professes that I believe in God.
Yeah.
So, and I'm not ashamed to say this.
Yeah.
The Creator, I don't think he was silly when he was making that your fertility is at a certain time. Yeah. It was the right time for you to be having babies when you're having your peak fertility. Yeah. No disrespect to those people who are having children at an older age, okay? But there's a reason he decided that your fertility should be higher when you're younger rather than when you're older.
Yeah.
And so it's just one of those things. So I think we need to have that conversation to help women plan also for their fertility, so that they're able to do it towards what I would consider the right time. Maybe I'm trying to remove a job for myself.
Yeah, and then sometimes like you've just been promoted, then at work they would, or you are an intern at even 28, and so you're like, if I get pregnant, I'll not get this confirmation. It's a serious dilemma, though.
It's a very serious dilemma, but it's something that for those of you who would want to have family, what's more serious? When the probability is now struggling with infertility. Yeah. And there's no disease as bad as infertility. I'm not saying that cancers are horrible. I think in terms of the physical and the journey and what you have to go through, and I don't even want to compare it to cancer directly, but the difference between something like infertility is that it's something so personal. A lot of people suffer in silence. People are not able to share that this is my problem. Somebody would easily tell you, I'm diabetic, okay? Or
even cancer.
Yeah, I'm having cancer. Yeah. Somebody's going to tell you, I'm infertile. Yeah. So it's a disease whereby a lot of these women and couples, they suffer alone and they suffer in silence because it's a very personal. It's almost taboo to talk about it. Yeah. So it's very heart-wrenching from that point of view. Yeah. And we have seen, especially, unfortunately, the people who bear the biggest brunt for this are women. Yeah. We've seen women being chased from their marital homes, being mistreated because of this very simple thing called having a baby. Yeah. So, and I'm like, why would you want to invest so much money in storing your eggs when you can just have the baby and you don't have to? Yeah. You don't have to store the eggs. And again, also looking at people have different ways of looking at the same issue. A lot of people are very against the assisted reproduction. And me, I'm like, you know what? Kila mtu, you do what works for you. Yeah. Yeah. But in terms of treatment, you always look at what is the cause. So majority. So if it's just a hormonal issue, like for example, it's a thyroid issue, if we find it's a thyroid issue and we're very easily able to correct thyroid problems with medication, once you correct that, you may find that the fertility is able to come back. Yeah. Same people who have, say, prolactin issues, you correct the prolactin levels, and the woman should be able to conceive. Same with PCOS. So, like if it's a hormonal issue, just to find out what type of issue it is, correct, and you find that majority of those couples will be able to conceive. Yeah. But you can find, despite treatment, some people are not able to correction, they're still not able. You go to a higher level, you add, say, ovulation induction. Now, ovulation induction, like just say for people who have prolactin and PCOS, the hallmark is they're not ovulating. Yeah. So in ovulation induction, you're trying to help them to ovulate. For other people, you're trying to help them have what is called super ovulation. So you have more than one egg being released. Maybe we give them drugs to do that. And for some people, when they use that, it does help them to conceive. We go to tubal blockage. Because of tubal blockage, currently the most common treatment worldwide for tubal blockage would be IVF. But we still look at very young patients. So you have a patient under 30 and they have a tubal blockage that's amenable to surgery. That could also be an option whereby you do surgery to repair the tubes for some of these patients. But that would be recommended in very young patients because, again, remember we said they still have time. In an older woman, you'd want to push them to doing IVF. IVF is the in vitro fertilization, or what we call the test tube babies. And that really changed the landscape of fertility treatment and has helped a lot of women who have tubal blockage.
Okay. And Doc, let's make this clear. When you talk about age 35, does it mean that it's about getting your first baby before 35 or all the babies before the age of 35?
Okay. As we've said, your fertility is peak under 35. So if you want to have a family of 4, it would obviously be good. Try to have this family of 4 by 35. But if at least you have a child by 35, you understand? It's good. And remember what we have said. We're not saying that you cannot have children after the age of 35. So let me just be very clear about that. What we're saying is that after 35, because your fertility is dipping, it means you're risking having a harder time conceiving or not conceiving at all.
Okay. For a woman watching, they're over 35. Oh, Dr. has said this.
No, we have not said you cannot have a child. All we're saying is that if you're trying to conceive, don't wait more than 6 months before you go to look for a healthcare provider to help figure out and help you conceive.
So, Doc, finally, are there habits that contribute, like daily habits by women that could contribute to infertility?
Obviously, and that's a very good. They're not direct causes, but they do have an impact on your fertility. So all these vices we're told about, alcohol, smoking, substance abuse, they do have an impact. And even if you manage to conceive, they would have an impact on your baby. So these are habits we would obviously promote that anyone who intends to conceive should stay away from them. What can promote pregnancy? So you also look at it from the other side. You find even simple, just doing exercise, you have more oxygen reaching your tissues, you're healthier. You find that would improve your chances of getting pregnant. So exercises, eating a good balanced diet, and hydrating well, you're healthier. Obviously, you're going to have easier time getting pregnant, and you're also going to have a healthier baby.
And there the losing weight journey. Sometimes you do extreme programs, like even surgeries. Do they also have a hand in it?
Okay, so in terms of surgery, you really have to look at who is your patient, okay? So if you obviously have these morbidly obese, and remember, obesity also reduces your chances for pregnancy, okay? It does have an impact on your fertility. So you have the morbidly obese. One, what are the chances? So one would impact on your getting pregnant, but more so would impact on the course of the pregnancy. Obesity is going to be associated with things like high blood pressure of the pregnancy, diabetes of pregnancy, all these complications that you don't want when you're pregnant, because you're pregnant to have a baby. You're not pregnant to just say, I was pregnant.
Yes.
Okay? So you want to go through the pregnancy in a healthy state without any complications. So some of these things, you have to look at it. So for some people, it would be recommended that they do have to go to extreme measures before they conceive, because it would not be healthy. It would not be conducive for them to conceive as they are, and when they conceive, at that state would not be healthy for the pregnancy.
The age factor, is there a link between the time that you're having a baby and birth defects? Yeah.
Okay. So yes, but we've made it look like if you're over 40, all your children are going to have Down syndrome. That's not the case. You find that whatever the age, any woman who is pregnant can have a child who has congenital abnormalities. Okay, but you find in the younger woman, their risk is very low. You find they have those 1 in 2 million, 1 in 100,000 risk of having a certain congenital abnormalities. In the older women, their risk is higher. So you go to those 3, 4, 5%. So, but you see, it's not that every pregnancy. Many women who are over 40 who have been pregnant and have normal pregnancies.
Oh, Doc, thank you so much. I've learned a lot. Dr. Maureen always says that have your babies, like each time I talk to her, have your babies before 35. I think it's because she knows I'm not 35 yet. Well, thank you, Doc, for being here and for educating me and other women out there about the need to look out even for some of these daily habits that could indirectly contribute to infertility. All right, that's the end of our show today. Thank you so much for watching. It's always a pleasure having your company. My name is Purity Afya Show. Remember to hit that subscribe button, and I'll see you again next week, same place and same time, God willing. Bye-bye for now.